How to not get ripped off when seeing a dentist, and how to navigate the healthcare system like a pro. So, I'm going to be talking about in this video the way I think about the healthcare system and how I've learned to navigate it. I've been working in the dental field for about the last 5 years. And this was my second time to the industry. I actually left saying I would never come back because there wasn't enough money in dentistry to care for the patients. There was every excuse for the dental insurances to say no, and then the dentist would just start asking the patients for money. The reason why I came back into this industry and the reason why I'm so passionate about creating this content is because I wanted to help other people not get ripped off when they go to the dental offices. And right now, that is the most common thing that we see in the dental industry. And it's not that the dentists are meaning to rip people off, but there's such a disparity in the cost of dentistry across the nation. And this is just because there's not the convenience, there's not like a Walmart for dentists to shop at. And because of it, their pricing fluctuates a lot. And instead of asking insurance companies to pay them, they've resorted to pressuring and asking patients to pay cash. But the thing that I figured out is over the last 5 years, Medicare and medical insurance will pay the dentist. It's just that most dentists and dental office managers don't know how to do it. So that's what I'm going to share with you in this video is from the perspective of someone that's worked inside a dental office as an insider. I want to help you, or rather, I want to share with you how I think about navigating the healthcare system just as if I were to do it for myself or like my grandma or my mom, for example. I know Mother's Day is coming up, so maybe this is just right in time for that. And this is exactly what I'm talking about when it comes to navigating the healthcare system. So the way I would want to do it is first of all, understand that health starts from the mouth. Most people go to a hospital or they go to a doctor, they go to an ER, but 90% of the time, or 70 to 90%, so let's say at least 70% of the time, the health issues, whether it's a heart disease, a breast cancer, or some kind of brain issue, or any kind of other issue in their body, 70% of the time, that issue is actually some other issue that may start in their mouth. And what I mean by that is if we have an infection, if we have disease, or if we have decay anywhere in the body, but especially our mouth, and we leave it alone, well, our blood circulates and our body circulates. So it goes without saying, we don't need to be a scientist to know that if we have infection anywhere, but especially our mouth, because we drink, we eat, and if we have all of our food or our water pass through the infection, then of course it's going to spill into the rest of our body, even without circulating. But if you take the mouth or any problems in our mouth and you add to that, that's where we eat, that's where we drink, that's where we breathe. It goes without saying that the mouth is the most important part of our health and our body. So we want to make sure we get that right first. So I'm not recommending everybody go to a dentist. In fact, there's some studies saying that we probably don't need to go to a dentist as often as dentists want us to come. Like they say, or we're told that we should go to a dentist every 6 months or 2 times a year. But there's a lot of scientists and a lot of doctors saying that it's kind of the same thing if we just see a dentist every 2 years and we do our proper cleaning and we do our habits right in between. Because at the end of the day, a dentist isn't going to be able to fix for us what we don't do for ourselves. And that's why there's a lot of new technology out there for implants. And even in the future, there's talking about regrowing teeth. There's amazing technology out there, but the cost is so high, most people aren't able to afford it. So in this video, I'm going to share with you exactly what you need to do so that way you don't have to overpay and you don't get ripped off. And it starts with understanding one of two things. You want to either find a Medicare credentialed dentist, or more commonly, you want to talk to a health planner. And I'll leave a link below where you can sign up for more information as a patient, subscribe for more information. And there's a weekly newsletter that we'll be sending out. Sometimes we might even send out more emails than that. But you'll know the information that you need to know as a patient so that way you can navigate the healthcare system and not have to overpay. The way that I've done it in my practice and for myself, if I was a patient, is I would look to use my medical plan or Medicare first. And even though I'm not 65, If there's any friends or anybody that I know that has any chronic conditions, illnesses, or diseases, you can still apply to Medicare. And the reason why I keep talking about Medicare, and I really believe it's the best reimbursement, it's the gold standard for medical reimbursement here in the nation, is because there's no limit on how much they will cover. Once you have Medicare, they will restore you or make you full, with the exception of the dental piece, because most people just aren't educated and they don't know how to do the medical billing right. And that's what I learned from my partner. And my business partner and I, for the last 5 years, have been doing just that. So we've been helping dentists get credentialed and helping them to bill. But what we noticed is we still weren't helping the patient directly. We still weren't helping the person that needed the help the most. And so that's what this video is designed to do. Is I have a guide that walks you through this process as well, if you want to just pick up the guide, because I won't be able to go through all of the steps. And it's a lot easier when you just read the instructions to follow along. But the most important thing that you want to do is go to either a Medicare credentialed dentist or someone that understands how to take medical billing and how to send medical claims. And then number two is if they don't know how to do that, but you still want to work with your dentist, I would recommend that you find a health planner. And you can find a health planner. Again, I'll leave a link down below on where you can sign up to find a health planner or have a health planner reach out to you. And whether it's just a couple of questions that you ask for free because they have these webinars and the presentations that they do for patients, or whether you decide to hire a health planner, it's usually in the best interest of you as a patient to hire a health planner, because it's a lot cheaper rather than paying like $3,000 or $4,000 or $5,000 for an implant. Working with a health planner, they can help you reduce that cost so you pay little or nothing out of pocket outside of what it costs to hire a health planner. And it's not expensive. You can hire a health planner for as low as $29 or $49 depending on what your needs are. And you can get help with not just getting your medical claims sent, and the medical payer or the insurance will pay the doctor directly. It's also about using your dental insurance or workers' comp or your auto insurance to pay for any of the remaining portions. Even if you don't have dental insurance right now, what most people don't know is there used to be a waiting period where you sign up for dental insurance and you have to wait 6 months before you could get treated or before you can, use any of the money from the dental plan. But the best thing that happened over the last 4 years is all those requirements went away. So today, literally, if you need any work in the mouth and if you sign up for a dental plan, if you pay the $50 or $100, you can get up to $1,500, $2,000, and with a health planner, they can show you how you can get even a little bit more from these companies the right way, and how to ask for, instead of getting the standard deal, how you can get the maximum deal, so that way you don't have to pay out of pocket. And you can even get 2 or 3 of these plans to reduce your bill. So I hope that makes sense. You want to find a Medicare credentialed dentist. It's less than 3% of dentists out there right now. Don't let that discourage you. You can go either on Medicare's site, or again, you'll find a link below where I'll give you information on signing up for our newsletter, or on where you can find a health planner or get more information on hiring a health planner for your needs. Now, if you hire a health planner, what they'll do is they'll help you either get a second opinion or get other options on what you need to do or what you can do, so that way you don't have to pay cash and you don't have to pay out of your pocket, but you can have other grants, insurances, or other programs pay for the work that you need. Remember, 70% of all heart disease and breast cancer starts in the mouth, and we're finding out actually 90% of the issues that most people go to a doctor for, it starts in the mouth. Whether it's a disease, whether it's the foods that we eat or the water that we drink, we want to make sure that we keep our oral health in tip-top shape. So I hope that makes sense. Remember that health starts from the mouth, that the mouth is part of the body, and that you cannot have a healthy body without a healthy mouth. That health is truly from head to toe. Take care, and we'll see you on the next video.